The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thanks so much for spending part of your evening with us discussing provider status and preparing for upcoming visits with members of Congress, whether this is going to be while you're in D.C. for the Summer Leadership Institute or whether you're going to be just visiting a home district office during the summer. I'm Lauren Bodie, the APhA-ASP Speaker of the House. Also tonight, you're going to be hearing from Michael Spira, the APhA Senior Lobbyist, Lauren DePuter, the Senior Manager for Grassroots Advocacy in our Political Action Committee, and then also Crystal Atwell, the Director of Student Development. Before we really get going, there's just some information I'd like to go over. There's two ways to listen in to the webinar tonight. You can use the telephone if you'd like to dial in and listen. It'll prompt you to enter the number that's on the screen, and then it'll just follow some prompts that'll get you connected. Alternately, you can also click use mic and speakers if you just want to use the regular webinar format. Whichever mode you choose, though, please do mute yourself so that we're not picking up background noise from you. There's a couple different ways you can ask a question throughout the course of the webinar. You can either ask a question verbally by clicking the raise your hand icon. What we'll do at that point is we'll unmute you and let you know that you can ask your question. Alternately, you can also just type in a question into the little chat box over there, and that'll go directly to us, and we'll answer your question when we get them. All right, well, to start things off, we are going to do a poll question just to see who's listening in tonight. So when that comes up on your screen, if you'll please go ahead and answer. All right, and I'm going to turn this over to Crystal.
All right, so your poll is now open. Go ahead and choose the category that is most appropriate for you. And we'll give everybody just a couple more seconds to lock in who they are. All right, it looks like everyone has voted, so I'm going to go ahead and close this poll. And here are your results. So almost everybody joining us tonight is a student pharmacist who is going to be attending Summer Leadership Institute as well. All right, so back over to Lauren and Michael.
Thank you, Crystal. So my name is Michael Spira. I'm the Senior Lobbyist at APhA. And the goal and objectives of your visit for SLI on Capitol Hill will be provider status. And as you know, provider status is the #1 priority for APhA. And we believe pharmacists deserve to be part of the healthcare team and deserve greater recognition to improve patient care, and that's why it's our #1 priority. This has been something that pharmacists have lacked for decades, while nearly all other healthcare professionals are rightfully covered under Medicare. As you all know, and better than I, we have people not adhering to their medication. Pardon. We spend almost $300 billion annually on medication-related problems, including medication non-adherence. Chronic disease alone costs the U.S. $1.7 trillion annually, and that's more than 75% of healthcare spending. And when you look at the population where this problem lies, it's people 65% and older represent 13.1% of the population in the year 2010, but it's expected to be over 19% by 2030, and nearly 70% of Americans are on at least one prescription drug, and more than 50% take two. And almost 50% of people prescribed medications for chronic diseases do not take their medication correctly. So what's the solution? You all, pharmacists, you all can coordination of medications, comprehensive medication reviews, chronic disease management, wellness services and education, highly educated with more medication, education, and training than any other healthcare professional. That's important. Be proud of that. You go to school for 6+ years. You receive education and training alongside other healthcare professions. And because of the money that is being spent, wasted in our system, and because of the education and background and knowledge that pharmacists possess, APhA, along with others, created a coalition, the Patient Access to Pharmacist Care Coalition. And this is a broad coalition of pharmacy organizations and stakeholders united in promoting patient access and coverage to pharmacist patient care services. We want pharmacists to be part of the patient health care teams. That way consumers and patients have access and coverage to pharmacist patient care services. The coalition is united in support of a federal legislative ask, and this coalition was announced last year in March of 2014. There are currently over 30 organizations and growing, and if you look at this list, it's all pharmacy groups, patient groups, other healthcare providers. Like I said, I think we're at 35 now, and it's growing. So we're proud that we were able to unify around this ask. What is the ask? Well, the bill that hopefully you all have heard is the Pharmacy and Medically Underserved Areas Enhancement Act. In the House of Representatives, it's H.R. 592, and it was introduced by Representatives Guthrie of Kentucky, Butterfield of North Carolina, Todd Young of Indiana, and Ron Kind of Wisconsin. The legislation would alter the Social Security Act to recognize pharmacist services within Medicare Part B. Pharmacist services would be covered and paid for under Part B if they are provided in a medically underserved community. There are currently 137 co-sponsors, and as you can see, it's pretty evenly split, and that says a lot about the legislation. It says a lot that both Republicans and Democrats feel strongly about the issue, that it's very evenly divided, and that's rare, not just in today's political climate, but also for a health care bill. Common questions that we receive about the legislation are, what's the position of the American Medical Association? What do the docs think? And at this time, they are neither supporting the bill nor opposing the bill. They are staying on the sideline. So there's no opposition to the legislation. And we do have physician members of Congress who have co-sponsored the bill, both Republican and Democrat. We also have nurses who have co-sponsored the bill. So we are making headway with not just the medical community by keeping them on the sideline, but the medical community who are members of Congress. Another question we receive is, what is the cost of the bill? Whenever you open up Medicare Part B, it's going to cost something. We believe from private studies we have done, we being the coalition, that the legislation would cost less than $1 billion a year over a 10-year period. Unlike last year, this year we are happy and pleased to announce that we have a Senate companion bill, and the Senate bill S314 is exactly the same text and language as the House bill. The Senate bill is led by Senators Chuck Grassley of Iowa, Bob Casey of Pennsylvania, Mark Kirk of Illinois, Sherrod Brown of Ohio. And we currently have 16 co-sponsors. And again, you see how evenly split the bill is in the Senate, 7 Republicans, 9 Democrats. Again, the message is resonating in the Senate as it did in the House. So it's a fantastic message, and a lot of that has to do with you all reaching out to your members in the House and the Senate. So specifically, what does the bill do? So any pharmacist, any state licensed pharmacist with a BS or PharmD degree who may have additional training, depending on state laws, the services are state scope of practice. So there are no two states that have the same state scope of practice. And these are things that have been hashed out within the state by the state legislature in conversations with state boards of pharmacy and medical communities. And the patients must be those that live in medically underserved areas, medically underserved populations, or HPSAs, health professional shortage areas. And these are all defined by HHS. So it's any pharmacist who follows the state scope of practice and practices in a medically underserved area, medically underserved population, or a health professional shortage area. Those are the 3 key points of the bill, and that is as simple, and don't make it more difficult for yourself than what you see right there. If all these 3 points were followed, then a pharmacist would be reimbursed for their services under Medicare Part B. Now we have another poll question for you.
All right, so same procedures as last time. And I will go ahead and launch the poll so everyone can tell us how many co-sponsors we currently have. So go ahead and lock in your response. All right, just a few more seconds. Almost everybody's voted. All right, I'm going to close the poll and we'll take a look at the results. All right, 72% of you said 137 co-sponsors. So back over to you, Michael.
Thank you, Crystal. And I'm happy to say that we have 137 co-sponsors, but in the last couple of hours, we've added 2 more to that. So in the next day or so, you'll see, if you go to the website, it's up to 139. So again, the message is resonating, and members of Congress are listening to what we have to say and believe that pharmacists' patient care services should be covered under Medicare. So what's the future? So this will allow you to practice at the top of your license using the skills and training you've received in the 6+ years of schooling that you are going through. It'll expand job opportunities and greater professional fulfillment. But to do this, we have to make sure certain things happen. We have to keep the pharmacy community unified. We have to continue to grow and strengthen the coalition. But most of all, the effort needs your involvement. You student pharmacists have done a great job, but I believe you all can do even more in getting your chapters involved and reaching out to the members in the House and the members in the Senate to let them know what we can do. And I'm going to hand it off to Lauren DePuter, who's going to share and let you know what we have for you.
Hi guys, as you can see on the screen right now, you've probably seen it, but that card on the right, that's what we usually use at annual meeting for you guys to sign up for the provider status volunteer list. So if you're not already on the list, you can sign up on the website, but if you ever see these cards, please fill them out or give them to someone you know who hasn't signed up yet for the list. There's various things you can do. Coming at SLI is obviously a really big part of getting provider status passed. As I said, join us online if you haven't already. Contact your legislators, which you will be visiting with them at SLI, but the really important thing to do is build a relationship with the offices after SLI, so keep the relationship going after these visits, get their contact information, send them updates what's going on in your district, so just keep building up that relationship because that's how we continue to get co-sponsors on the bills. And while you're visiting them, feel free to invite them to tour, if you're working that summer, tour your pharmacy or your school the next year. They're more than willing to do it most of the time, and it'll really help them see what pharmacists are capable of doing and what you're trained to do. So feel free to extend that invite during your meetings. Definitely get involved with your state pharmacy association too. And you'll have an opportunity to do so at SLI, but please donate to the PAC. The PAC is one of the main ways that we educate members of Congress on provider status, and they'll definitely consider provider status legislation if they see a contribution from APhA PAC. So please donate whatever you can. I know you're students, but please donate whatever you can to the PAC. So we're doing it a little bit differently this year, how to schedule your Capitol Hill visit in case you've gone to previous SLIs. this is really good, but we're having a lot more students attend every year, so we're doing it differently. This year we're asking you to fill out a survey form of where you're registered to vote. So there's a link on the survey form. There's a link to the survey form in this slideshow, but there's also a link within the survey for you to figure out who your members of Congress are. So you would enter in your address of where you're registered to vote. We recommend. You figure out who they are, and if you could please enter in who your legislators are within the survey, that would be great. And if you could do it by June 29th, that would really help us out, because then we're going to have the APhA regional delegates reach out to you, and we're going to help everybody group together in case you have the same senators or the same representative in the House. So the congressional staff aren't receiving multiple requests for meetings. We don't want to annoy the staff if we're asking them to co-sponsor. So please fill this out by June 29th, and somebody will be contacting you and helping you form groups. So after June 29th, after you're contacted by the regional delegate, if you become the point person for your group, or if you are the only one with your senators or your representative, this is what you're going to have to do. There's a link. It's also set up on our Legislative Action Center website, but there'll be a link provided, and you fill out where you're registered to vote. And then a pre-written email will automatically generate to your senators and your representative. The pre-written email will have a request to meet about the legislation. If they've already co-sponsored the legislation, though, a thank you email will generate for you to send to them. We're recommending that you don't meet with members of Congress who have already co-sponsored the legislation. A thank you email will suffice. So you will see that once you enter in where you're registered to vote. And here's our contact information. If you are the point person for your group, or if you're not in a group and you're just on your own, if you have not heard from the offices about a week out from SLI, please contact me, and I will help you contact their offices. I'll get you better contact information than just sending it through their website. But contact me about a week out if you haven't heard back from them, and I'll help you out as much as I can. And Michael Spear's contact information is on there as well. And here we're going to have another webinar for you guys on July 7th at 9 p.m. And contact Lynette for housing and special requests.
Thanks so much, Lauren. We're now going to open up the floor to any questions you may have. Please don't hesitate. So you can, just as a reminder, you can do that either by raising your hand or by typing your question into the poll box there.
All right, Lauren, Michael, and Lauren, we already have some questions that have come in. So the first question is, can we receive a copy of the slide set? And I will go ahead and answer that question, and the answer is yes. We're actually recording the webinar tonight. We'll be posting the link on pharmacist.com, as well as in the events page for SLI in the APhA-ASP Facebook group. So this next question, I think, is for you, Michael. Is there a way to know which senators and which representatives have already co-signed the bill?
Yes, you can go to actually I don't even think it's www, I'm sorry. Just go to congress.gov and enter the bill number, HR 592, to see if your representative co-sponsored it, or to see your senators, enter S314, and then you just click on the bill number and click on co-sponsors, and it will pop on up. Once again, congress.gov, you enter either the House or bill number, and then click on that bill number, and it'll show you the list of co-sponsors.
All right, thank you. The next couple of questions that are coming in are in regards to the survey of where you register that you're going to be doing a Hill visit and who your representative and senators are. We will be sending out the link to all of our registered attendees. We'll also post that link on the Summer Leadership Institute page at pharmacist.com and as well as our Facebook event page. If you haven't liked the APhA-ASP Facebook group yet, please go do that and make sure that you get yourself linked into the event page, because we'll be posting updates on there throughout the time leading up to Summer Leadership Institute as well. So be on the lookout for that. Our next question in regards to making your appointment. So if after people make their appointment, they haven't heard back from an office, what's a reasonable time frame to wait to reach out to that office?
I would wait about a week to contact them again because they're busy up there. It might go into spam. I would wait about a week out, and if they haven't responded to you, if they haven't responded to you after twice contacting them, then email me and I'll get you some better contact information, some better emails for you to directly email them. But yeah, I would give it about a week before you contact them again.
All right, and when they're doing their initial outreach to set up their appointments, is there any key information that the students want to make sure that they share?
It's in the pre-written email, but please edit it with your relevant information, what school you're coming from, maybe some district information, because they really want to only meet with constituents, so they might be kind of picky about that. So make sure that you definitely emphasize that you're a constituent as well, and mention, you know, maybe some of the services that you've been trained to do in the email.
All right, Michael, this is going to be a question for you, and it's discussing kind of the process of the House and Senate bills. So what will happen if the House bill passes, and would that interfere with the bill that's already in the Senate?
No, so if I'm understanding the question, if the House passes the bill, what does that mean about the Senate?
Yes.
Okay. Very good question. So let's say the House passes the bill and the Senate has yet to do anything. That just the bill can then go over to the House passed bill will go to the Senate where it can be passed, or the Senate can take up their own bill, and since it's the same language, it's fine. But we hope to have both chambers pass the bill, and perhaps it gets attached to something, but that's all down the road. Right now, we just want to get as much support and more co-sponsors, and we hope that that's an issue we have to deal with, that we're successful in getting it passed in both chambers and onto the President's desk.
All right, thank you, Michael. Lauren Deputer, this is probably a question for you. Is it required to meet with legislators for the state in which you're registered to vote, even if you do not attend pharmacy school in that same state?
I know some of you have asked about meeting with where your school is. That's if where you're registered to vote, they're all co-sponsors already, then that's fine if you want to meet with your legislators where your school is. But just coming from my experience, they are members of Congress, are accountable to people who vote for them. So they really want to meet with constituents. But if I would recommend you can meet with your legislators that represent your school if where you're registered to vote, they're already co-sponsors. But where you're registered to vote should be the priority.
All right, and we have another question regarding the survey and process for getting set up. So Lauren Bodie, this is probably a question for you. How do you find out who your regional delegate is?
So if you, I'm sorry, would you say the question one more time?
Sure. So how would a student go about finding out who their regional delegate is?
Okay, so your regional delegates are all listed on pharmacist.com under the APhA-ASP section. However, you should be hearing from your regional delegate. If you haven't, please do let me know. My email address is laurenbodie2016@gmail.com, and I'd be happy to get you linked up. However, I expect that you will be hearing from them soon after the surveys are submitted.
All right, thank you, Lauren Bodie. So, Lauren DePuter, the next question is going to be for you. Shout out to Tara Landis, who already has an appointment scheduled. But Tara wants to know, since she already has this scheduled, should she cancel it and go through our survey process, or should she keep it and just let you and the rest of the group, Lauren, know that she's made it? So how do you want people to, if they've already made appointments, go about doing that in terms of the survey?
Well, that's great that you've already made your appointments. I think on the survey, I'm pretty sure it says, have you already scheduled your appointment on the survey form? So if you have, please just answer that correctly, and that should be fine. Please don't go cancel it. That's great that it's already scheduled. So just fill that out on the survey, and then if anybody else that is attending SLI matches up with you, then they'll be put into your group and you'll be notified.
All right, great. There's a question regarding whether attendees are required to do Hill visits. It is an official part of our schedule for Friday. If for some reason your flight gets delayed or you miss coming in, then we understand, but we highly, highly encourage everyone to make it a priority and a part of your Summer Leadership Institute experience. The only way that your congressional leaders are going to know what your patients need and what you need from the practice of pharmacy is if you go share your thoughts and ideas. And you can't do that if you're not at the table. So we've created this as a part of the schedule, and we want to do everything that we can to help you. So if you have any questions about scheduling your visits or making arrangements for travel, just let us know. Our next question, if a student is not registered to vote but has a permanent resident card, should they go and visit with their senators and representatives?
Yeah, you can. Fill out the link and maybe put a note or shoot me a note that you're not registered to vote. That's fine. We'll just be aware of that. They might ask you, but they probably won't. So you feel free to fill out the link to visit.
Sure, and you'll be going more than likely with a group of people or with one of our national officers or even some members of our APhA staff, and it'll be a great experience for you, an important advocacy initiative. So I would say don't let that sway you away from going up to the Hill. So we're down to our last couple of questions. If anybody has any final thoughts, make sure that you get those in now. Just as a reminder, we are recording tonight's session, and we will be posting the links in various places, as well as sending them out to attendees, along with the survey link that Lauren referenced earlier. That link is going to get posted tomorrow, and then should be emailed out early next week to everybody. So another question's just come in, and this question says, my zip code is split between two districts. Is there a way on the survey to inform you in which district I reside?
Yeah, on the link that's on the survey, if you fill out your full address, not just your zip code, a lot of districts are set up this way. You just have to fill out your full address into the fields, and it'll tell you who your member of Congress is.
All right, well, that looks like all of our questions, at least for this evening. In the next couple of weeks, as you prepare and go through the provider status material and start working to set up your Hill visit, if you do have any questions, please don't hesitate to reach out to us. We will be doing another webinar prior to SLI, and during that webinar, we will go over the logistics of going to the Hill, give you final talking points, make sure that you're 100% comfortable and confident with going up to your to see your representatives and senators. So with that, we have a couple more questions that just popped up. So this question is, what motivates specific senators to introduce or reintroduce the bill, and how many more co-sponsors do we need? So Michael, I think that's a question for you.
Sure, very good question. So the way we being the coalition, when we met, we said, who do we want to ask introduce our legislation? So first we looked at members who are on the committees of jurisdiction. So in the House, we focused on Energy and Commerce and Ways and Means, and on the Senate side, we focused on the Finance Committee. So then we looked at those committees and members of Congress who take an active role in health care, members of Congress whom we have worked with in the past, members of Congress that we have good relations with. So those are the things, and then we ask, and then we meet with them, we talk to them, explain why we feel this is an important issue, and then we educate them. And maybe for some it might take more education than others, and they believe in the issue, and the members we chose, or I should say who agreed to introduce our legislation, did so because they believe in it. And we also reached out to those because they have a good reputation on their committees. They are leaders in their committees, and they will put their full weight, name, and staff behind the issue to get it across that finish line. So that's how we chose those members, and that's why they agreed to do it. And I apologize, Crystal, I forgot the second part of the question, if you wouldn't mind repeating it.
So the second part of the question is, how many co-sponsors do we need?
There's not a specific number. Thank you for repeating it, by the way. There's not a specific number. The more, the better. We do need to grow both. We have almost 140 in the House, 16 in the Senate. I'd like to see those numbers keep going up, and up. And the more numbers, the higher the number is, the more supporters we have, the easier our argument can be as to why our bill should be voted on the House or Senate floor. So we just want to make sure we build those numbers to a higher, so they keep growing to make our case for us. The House, we're doing great work in the House. Senate, since we didn't have a Senate bill last year, we're going through more of an education process, and I'd like to see that number get higher too. And I expect it will, since the bill's now been out since the end of January. And over the last couple of months, the coalition has been doing a big media push. We have run ads in the Hill newspapers. We had an ad in the Washington Post. We are running ads on Washington, D.C. radio stations. So we're making a big push to educate members of Congress and their staff. So let's just keep growing those numbers, and you guys are the ones who can help us grow those numbers even more so through your Hill visits.
And a follow-up question for that, if for some reason the bill isn't passed this year, will it be reintroduced or will it carry over into the next session?
The bill carries over. So once the bill is introduced in Congress, it stays, it's there until the next Congress. So 2015 goes into 2016. The bill is the same. The two bills are the same in 2016. But we won't have to worry about that because we're going to get the bill passed in 2015 with your help and with you going to visit your members of Congress.
All right, I love that optimism. We're going to hold you to that, Michael. And with that, we are out of questions. If you think of anything afterwards, please just reach out to us. So with that, I will turn it over to you, Lauren Bodie, to close us out.
Thanks, Crystal. I really appreciate everyone coming and taking their time to learn about this, and I hope you all are so excited about doing your Hill visit. I know that personally doing a Hill visit for SLI the first year I went was really just like central to my SLI experience. And I also will mention that if you're feeling a little nervous or anxious, we're going to have some members of the NEC, some members of the Policy Standing Committee, along with myself, who are there to help you with whatever you need, and potentially act as a buddy if you just want someone to come along with you. So please feel free to reach out. We'd really like to support you in this. And that's all I have. Thank you so much and have a good night.